I'm going to further elaborate my partner's claims, bring up new ones, and address some points used on their side. In relation to how late-term abortions are performed under special circumstances involving the mother and fetus health, according to an assistant professor at Stanford Medicine, there are many reasons why women may need to access abortion later in pregnancy, including maternal health endangerment, diagnosis of fetal abnormalities, or restrictive laws delaying earlier access to abortion care. These exceptionally rare cases that happen after 24 weeks are often because the fetus has a condition that cannot be treated and will never be able to survive, regardless of gestational age or trimester. Nobody arrives at that decision to have an abortion after 24 weeks carelessly. Rather, it's a rare case of rapidly decompensating maternal heart disease or delayed diagnosis of anencephaly, where the fetus forms without a complete brain or skull, which brings people to these decisions. My opponents also stated that if the fetus feels pain. Well, the content of pain for an unborn fetus is questionable and a subjective experience. In a journal by University Professor Stuart Derbyshire, pain is always subjective. Each individual learns the application of the word through experiences related to injury in early life. The limited neural system of fetuses cannot support such cognitive, affective, and evaluative experiences, and the limited opportunity for this content to have been introduced also means that it's possible for a fetus to experience pain. Fetal pain has not been studied to be perceived until 24 weeks. According to Assistant Professor of Reproductive Biology, Kavita Shah, and gynecologist Christina Salazar, while the neural pathways that send nociceptive signals have completed by 23 weeks, a comprehensive and multidisciplinary review of almost 2,000 fetal pain studies concluded that the capacity for functional pain perception in preterm neonates probably does not exist before 24 weeks. Until the conscious ability to process nociceptive signals develops, it is by definition impossible to register pain. For a fetus to feel pain, the cortex will need to be fully intact to register it. For a fetus, in an article by journalist Dave Levitin, in reviewing the neuroanatomical and physiological evidence in the fetus, it was apparent that the connections from the periphery to the cortex are not intact before 24 weeks of gestation. And most neuroscientists believe that the cortex is necessary for pain perception, and it can be concluded that the fetus cannot experience this type of pain. A woman also has a delayed abortion because of scarcity of money. The average cost of an abortion is from $350 to $500. The longer the pregnancy, the more expensive it becomes. The American Civil Liberties Union states, because the cost of an abortion rises dramatically as pregnancy advances, government-mandated delays put abortion out of reach for many women. Whereas first trimester abortions obtained from a non-hospital provider is from $350 to $500, the second trimester at a clinic can cost at $1,000 or more. And most clinics don't perform the second trimester abortions at all. According to Rachel and Lawrence Miner from Gutmaker Institute, in one study of women who were having an abortion at 16 or more weeks, a substantial percentage said the delay occurred because they needed time to raise money. Women who depend on the federal government to provide their health insurance coverage must pay for abortion services separately. They may receive Medicaid funding for other medical services, but the federal government in most states has prohibited the use of federal funds to pay for almost all abortions. It's also recognized that growing restrictions on public and private insurance coverage for abortion may increase the need for second trimester abortion by further delaying women's access to services early in pregnancy, while also reducing the access to the second abortion services for poor and low-income women who need them. Women with family incomes at least 200% of poverty were more likely to obtain abortions at this stage. Patterns in insurance and income suggest that the higher cost and decreased availability of abortion services at later gestations may make them less accessible for poor women and those who pay out of pocket. Law restrictions and ethics also influenced many doctors to not perform abortions, making it difficult to obtain a first trimester one. 86% of countries in the United States have no doctors trained, qualified, and willing to perform abortions. For instance, in North and South Dakota, there is just one doctor in each state who provides abortions. And throughout the country, many of the clinics don't offer abortions, only do so once or twice a week because of the scarcity of doctors. Given these realities, many women, particularly those who live in rural areas and where abortion providers are few and far between, must travel hundreds of miles to reach the nearest clinic. Certain laws require facilities to follow very difficult and expensive requirements. In an article by Bonnie Scott Jones and Tracy Whites, who are involved for the Center of Reproductive Rights, The lack of public financing of abortion care and restrictions on insurance coverage mean that even small changes in the price of an abortion can have devastating effects on access to care for low-income women. Increases in costs disproportionately affect low-income women who need these services. With less abortion centers accessible, it deeply affects the chances of a woman obtaining an abortion during the first trimester. For instance, in a 2019 article by the University of Texas, a new study by the Texas Policy Evaluation Project finds that the number of second trimester abortions in Texas increased 13% after the implementation of the restrictive abortion law known as House Bill 2. Even as the total number of abortions declined by 18% overall, women who received abortion care 1 week later on average in the period after the law took effect. The study concludes that the law's provisions, which resulted in the closure of half of the state's abortion facilities and created provider shortages, delayed Texas women's access to abortion care. These findings show that restrictive abortion laws reduce women's access to care and delay the timing of their abortions. So late-term abortion should be available as an option with women of the compelling reasons with health risk, poverty, and restrictive laws that delayed their access to an early abortion.